The news day continues here on One News Now. I'm Sean Yao. One OCTA Research fellow is optimistic that COVID-19 in the Philippines could be considered endemic as early as summer next year. We have infectious diseases expert Dr. Ron Solante joining us over the phone to share his insights. Good afternoon, Dr. Solante. Welcome back. First off, do you think that COVID could be considered endemic in the next few months, vis-a-vis the emergence of a new variant of concern, which is Omicron?
Yes, sure. No, there's a possibility that it can be endemic, especially now with vaccination rate is going full blast. And there'll just be pockets of infections that are not a concern. But still, we want to believe that without a new variant of concern, which might change the game in terms of the current vaccine efficacy, then I hope it will not happen. But again, that's just one of the possible scenarios. But hopefully, it will be like that, and every one of us should be vaccinated.
Dr. Solante, can you tell us, for the benefit of our viewers, the difference between COVID-19, being a pandemic and it being endemic or being considered endemic? What are the factors that we should be able to tick off or consider?
Well, number one, if the vaccination rate will not be 100% and there are still people who may be vulnerable to it, then they can still have the infection, but only less numbers. So that's why it can be endemic, not involving significant number of the population. Number two, if we continue to practice also health protocol and lessen the transmission, then that can also help in terms of immunity and protecting ourselves. And number three, I think what's crucial here, Sean, is the booster doses, because we know that post-vaccines effectiveness waned after 6 months. So after 6 months of this booster dose, what will happen? Will we have emergence of new cases because of a waning protection? And that's why we need to, again, give another dose for us to maintain the low level of cases.
Right. Let's step back a little bit, Dr. Solante. We know that, health experts around the world, not just here in the Philippines, are saying that for it to become endemic, we have to treat the world as a whole, or the entire planet basically as a whole, and all, human beings in it. Having said that, Doc, can we say that, COVID is endemic in the Philippines, but it's not yet perhaps endemic, or cannot be considered endemic in other parts of the world? Or should this whole thing be, as one, as an entire planet altogether?
It should be a global equity of vaccine. So everyone should be receiving vaccine, whether you're in a low-income country or in a middle-income country, because one country that will not have 100% protection, people will travel to another country because countries will be opening up, and that's, again, a source of transmission. So everyone should be receiving globally.
Right. Well, let's go back and circle back to what you said, Dr. Solante, about vaccinations. While we are already advancing and doing better with regard to vaccination, there's still a significant number of the population, both here in the Philippines as well as in other developing nations around the world, that have no access yet to vaccines. Having said that, Doc, will this actually cause any delay before we can consider COVID-19 as endemic?
Correct, no, because that's also the other area of the government should also address. It's not just the supply of the vaccine. If we have supplies of the vaccine, but we cannot access, and there will be poor accessibility, especially in the far-flung areas, then that would defeat the purpose of herd immunity. So as much as we have more vaccines, then the government should see to it that this vaccine should be delivered right there in those countries or in those areas, in those provinces where vaccination rate is really low. And I'm talking here outside of Metro Manila, where vaccination rate is still low. And that is really to advocate and, again, engage all of this. Particularly, Sean, there are still vaccine hesitancy around in our population, and I think we need to engage these people that the vaccine is very important.
Right. Well, Dr. Solante also mentioned, of course, booster shots. A lot of us are already, eligible to receive booster shots. And of course, you quite rightly pointed out that a big chunk of the population are still unvaccinated or maybe partially vaccinated by now. Looking forward into the future, do you see that booster shots will become a way of life?
Okay, we need to look at data first. our concern now is any variant that will mutate to affect vaccines. And so far, Omicron variant, we have vaccines for that. The current vaccine is still effective. What after Omicron variant? That's the scenario that we're looking at. Are there more mutations? Is this a more virulent variant, or is this more resistant to current vaccination? Because if that will be resistant to current vaccination, then we'll go back to number one and give the vaccine that is specific for that variant.
All right, so still a lot of moving parts here. Thank you, as usual, for your time and insights. Dr. Jean Solante, infectious diseases expert. Thank you so much for your time, Doc. And the health department says that CALABARZON was able to hit its target of inoculating 1 million individuals during the national vaccine drive. Dr. Felices Perez of the DOH Region 4A told One Balita Tanghali that some 5.7 million residents in total have received their shots in the region. Perez says they are targeting to vaccinate 3 million more in the second round of the vaccine drive on December 15 to 17.
Kasi ang ating CALABARZON, tayo ay maraming bundok at dagat. So marami tayong mga GIDA areas, mga isolated po, mahirap abutin. So tayo po ay patuloy na humihingi ng augmentation from other agencies po. Saka assist naman sa atin during this vaccination on December 15, 16, and 17.
Perez also noted that hospitals in the region are not as congested as before, with some even logging 0 cases. She adds that new cases average around 44 per day for the whole region of CALABARZON.
Ang ating mga hospitals ngayon ay hindi na punuan. Medyo yung ating mga TTMF na, yung ating mga HRH o yung mga health workers natin sa mga isolation facilities, pinull out natin para maging vaccinators po sila ng Laguna.
And experts around the world are saying that the Omicron variant is no worse than other COVID-19 variants. W.H.O. Emergencies Director Michael Ryan told Agence France Presse that preliminary data does not indicate that Omicron is more severe as compared to other variants. He explained that while Omicron appears to be more transmissible, it is unlikely that it will completely evade vaccine immunity. Ryan noted, though, that more research on the new variant is needed. However, some health experts are warning that the Omicron COVID variant may be more transmissible than Delta. Mobile journalist Jacob Lazaro with the details.
The new Omicron variant brings so many uncertainties to the table, and the healthcare workers are worried that the new variant could bring in a surge bigger than what we can handle.
Kasi mas mata-target nito yung mga hindi bakunado, no? Kasi sila yung walang protection.
The Omicron variant has already been detected in almost 50 countries just 2 weeks after its first detection. Because of this, the OCTA Research Group thinks that the Omicron could be at least 2 times more contagious than the Delta variant. According to the World Health Organization, a study from South Africa showed that the Omicron has 3 times bigger reinfection rate than Delta. The Philippines still has no reported case of Omicron, but local health experts agree that it's just a matter of time before it enters the country. Authorities are locating and monitoring 253 travelers from South Africa, one of whom turned positive for COVID-19. The country's average healthcare utilization rate is at 20%, or classified as safe. At this number, Limpin said that the healthcare system has already recovered from the last surge and is ready for the next. However, each new surge puts an even greater strain on the hospital resources and personnel. Limpin notes a steady migration of experienced healthcare professionals abroad.
Ang matitira dito sa atin ay medyo bago, therefore hindi pa masyadong experience. Tapos once na naman magkaroon na naman sila ng experience, aalis na naman sila.
The IATF is considering downgrading the capital regions to Alert Level 1. But Health Secretary Francisco Duque III said staying under Alert Level 2 might be the best.
Una-una, ang mobility, tataas na naman ngayong kapaskuhan. Alam natin yan, no? at meron nagmamadyang o ang Omicron variant. So mahihira, mas konservatibo tayo.
Limpin adds that with the threat of the Omicron variant, it's still better to err on the side of safety. Mobile journalist Jacob Lazaro, we are One News.
We'll be back with more stories after this quick break. Keep it here on One News. You are still watching One News Now. I'm Sean Yao. The Health Department recorded 370 new COVID-19 cases on Wednesday. This has brought total infections to 2,835,000, some 12,500 of which are still active. 171 new COVID-19 related fatalities were likewise reported today, bringing the death toll to more than 49,700. Meanwhile, total recoveries have now hit 2,773,000, with over 850 new recoveries logged in the last 24 hours. And out of the nearly 29,000 tests conducted, 1.6% tested positive for the virus. Niña Niño lead actress Maha Salvador will be starring in the thriller film Arisaka, which premieres on Netflix this month. MJ Marfori with that story.
TV5's very own Maha Salvador and veteran actor Mon Confiado walked the red carpet for their newest action thriller movie, Arisaka. Maha brings to life the character of a policewoman who has to retrace the route of the Bataan Death March to escape her captors. But the mysteries unfolded along her journey.
Nakakatuwa, parang mas nakaka-excite pang gumawa ng maraming pelikula.
Nabigyan ng pagkakataon yung mga ganitong klaseng genre na at least hindi puro love story ang mga pelikula natin.
Like her character in the film, the actress has always chosen roles that empower women.
Dito makikita po natin na ang mga babae ngayon ay may boses na. Kasi mas pinapahalaga na sila sa ating society.
Critics, meanwhile, said that this is the Philippines' answer to South Korea's globally acclaimed Squid Game and Hellbound. Viewers can watch Arisaka on Netflix starting December 9. For News 5, MJ Marfori, we are One News.
For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Masks on, wash hands, and stay safe, Philippines. I am Sean Yao. We are One News.